Hi, I'm Dr. Pelto. Welcome to Healthy Living. And today I have a guest, Brittany Falcone. She's a chiropractor from the area of Worcester. So Brittany, thank you so much for coming in.
Of course, thanks for having me.
So tell me a little bit about yourself and how you got interested in chiropractic medicine.
Sure. So I have actually been a chiropractic patient since the age of 10. And I was the first person in my family to see a chiropractor, believe it or not. And it was for something kind of embarrassing, actually, for bedwetting.
Okay.
Not a lot of people even realized that maybe the condition of bedwetting could be helped by chiropractic care.
Yeah.
My mom tried everything at the age of 10 when I started wetting the bed, and nothing helped. And finally, someone told my mom to try chiropractic. And I'm sure she thought one of two things. The first thing she probably thought was like, you're crazy. You know, what does my daughter's back have to do with her bedwetting? And then the second thing she probably thought was, why not? You know, she tried everything else and nothing really helped me.
Yeah.
So sure enough, she brought me to the chiropractor, and I was one of those miracle cases where I got treated for the first time and I didn't wet the bed for a week straight. So yeah, it was a pretty powerful and amazing thing. And that's when my whole family started to go to the chiropractor, and it's something that we did together.
Yeah.
And I really share this story with you for 3 reasons. I think number one, you never really realize how far reaching something you say or you do is going to affect someone. So I can't tell you to this day who told my mom to bring me to a chiropractor, but because of what they said, I'm sitting in front of you here today as a doctor of chiropractic. Yeah. So it's pretty powerful. The second reason I share that with you is that because of my experience with my whole family seeing a chiropractor, that's now my specialty. So there's lots of different aspects of chiropractic, but in my practice, I see a lot of new and expecting moms, a lot of children, and a lot of families. Okay. So not all chiropractors are created equal or do the same thing. Yeah. And the number 3 reason I share that with you is, again, you've never realized that bedwetting could be a symptom of something going on with your spine. So it helps us realize that our back's about a whole lot more than just our back.
Yeah, yeah. And so you did your college. Where did you do your college at?
Yeah, so I went to undergrad at Vanderbilt University. That's a school in Nashville, Tennessee. And something interesting about me, not only was I a student, but I was a student athlete there. I was a NCAA Division I bowler. So,
bowler?
Yes, bowling.
Wow.
You never know that you could get a scholarship to bowling, at such an elite school.
I'm going to have my kids do bowling.
Yeah, a lot less competition that way, for sure. So I competed on their team and excelled in both academics and athletics. Yeah. I graduated in 2010 and pretty much immediately went to chiropractic college and graduated chiropractic college in 2013.
And then were you from that area? Were you from this area? How did you end up in Worcester, around Shrewsbury?
Yeah, good question. I grew up in New Hampshire, about an hour away from here. Yeah. But my husband is born and raised in Worcester, and he actually graduated from St. John's. Okay. In Shrewsbury, everyone's going to like that. So when we found out we were expecting our first child, who she'll be 2 in a week or so, we decided to move back to the area to be near family. Wonderful. And that's what brought us back here.
Wonderful. So in terms of chiropractic care, for general chiropractic care, we were talking about a lot of the viewers here. They might not know kind of what a chiropractor does. Some may have gone, others may have not. And I think, as we talked about, there's some kind of misconceptions and some questions about chiropractic care. We might as well kind of look at some of those.
Oh, sure. Great question. So I think there are 3 things about chiropractic. There's so many, really. When I was preparing for this, there's a lot of things that I get asked on a weekly or a daily basis. But there are 3 top things I think that are misconceptions about chiropractic care. The number 1 thing being you only need to see a chiropractor when you have pain. Okay. For example, in my case, I did not have any back pain at all, right? My symptom was bedwetting, but I was still able to go to the chiropractor and get benefit. We forget that pain is really only a small portion of what's going on, and that the only reason we feel pain is because our nerves feel pain. And of all the nerves that are sending information up to our brain, only 2% of them are pain sensing. So if you have a problem with your foot, or you have a problem with your tooth, or if you have a problem with your back, it's incredibly unlikely that your first symptom is going to be pain, right? You'll experiencing something else first. And actually, if you refer to my little
diagram
here, you can see how our nerves here have motor portions to them. They have parts of our nerves that go to blood vessels, organs, and glands, and then here's the sensory portion. And then it points out here, you can see that the sensory part, which transmits pain, is really only a small portion of what's going on. So if we only use pain as a way or a barometer to measure our health, it's really not an effective tool in doing that.
Very interesting.
So again, you don't only have to have pain to see a chiropractor.
Okay.
That's the first one. I see a lot of kids in my practice, and that's another common misconception is that children.
Who I think of, I think it's older adults that hurt their back. That's what I think of chiropractic care. So it's not just that.
Yeah, that's definitely our reputation, and we are good at treating back pain, at treating neck pain, at taking care of headaches, or after a motor vehicle accident or a work injury. But again, we can see any patients from womb to tomb or from birth to death. So again, if you believe that first common misconception that you only need to see a chiropractor when you have pain, you'd also believe that children can or don't see chiropractors.
Okay.
But again, that's not true. In most of these cases, it is generally that we're being more proactive or preventative. Once your child has teeth, would you take them to the dentist? Yes, even before they had tooth pain, right?
Yeah.
Because you want to prevent a cavity.
Correct.
And that can be the same case in my practice or in the chiropractic office when taking care of kids, that we can be more preventative and more proactive in taking care of their spine because it can really affect their body in lots of ways.
Yeah, well, interesting.
Yeah. I have one more
Yeah,
common
what's the other one?
misconception. Yeah, the last one is that, and I'm sure you've heard this before, a lot of people say, well, once you go to a chiropractor, you always have to go back.
I do hear that.
Yeah, it's very common.
And is that true or is it not true?
Both.
Okay.
So that's there's not a right or wrong answer to this. It is true and not true. I'd say number one thing, it's true because, to be honest, every person that walks through my door, I hope to create a lifetime patient. And I have no problem saying that to you because guess what? I'm a lifetime patient myself. I've seen a chiropractor at least a weekly or a monthly basis since the age of 10. My daughter gets checked, my husband gets checked, my mom, my dad, my brother, my entire family. And I have no problem asking my patients to do something that I do for myself so that they can experience the health benefits of that. But it's not true in the sense that, it's ultimately up to the patient how much or how little chiropractic care they receive in the office. I can't ask you to do something that you don't want to do. And if your goals don't reflect, what I think you need or what you want to do, then we'll meet you in the middle somewhere. So it's true and not true.
I know. Yeah, it's interesting. And so in terms of treatment, I know kind of within different areas of medicine, there's different specialties. And what are the things that chiropractors maybe can treat, or what specialties are there within chiropractic care? How do you get the training for that?
Sure. So I think some specific conditions that are very common that we see in the office. Number one thing is obviously going to be back pain or neck pain. Headaches are a big thing that I'll see in my office too. Sciatica, if you've ever heard of that before, where you can have pain shooting down the legs. Sometimes if there's pain or numbness or tingling shooting down the arm, we call that a radiculopathy. We'll see that in the office. And then some unusual things we'll see that aren't necessarily pain related, but again, more visceral, more organ. We talked about bedwetting earlier. Colic in babies, breastfeeding challenges. We can do some work with their mouth and their jaw and their neck to help them achieve a better latch. Ear infections we have a lot of success with. And the reason for these things are just because there is research that shows that taking care of the spine can boost certain immune factors in the blood. So it actually helps improve your immune system. And that's why your body just starts to be healthier and you have less allergies and less infections. So.
Wow. And so now you're in a group with a couple of other chiropractors. Does everyone treat the same thing? Do you all like to focus on certain things in terms of specialties or specific to you? I know you like to children, and so is that something you just chose, or because of your experience when you were a child? Is that how you chose that?
It is true. There are chiropractors that specialize in different things. Some of us are generalists. We do a little bit of this and a little bit of that. There are some offices that focus mostly on what I would call structural correction. So say someone has a scoliosis, which is a curvature in the spine that's not supposed to be there. There are certain offices that will work on reducing or correcting that scoliosis. Some offices that are mostly personal injury. So after an auto accident or a work accident, they'll rehabilitate people after that. And then there's specialties in sports or extremity adjusting, for example. And then, of course, as you said, my specialty in pediatric pregnancy and family care. In my office, there are 2 other doctors, and I'm the only one that specializes in this technique.
This technique, okay.
So in fact, there's a technique called the Webster technique.
Yeah, so tell me about that.
I'm the only chiropractic physician in Worcester who's certified in that technique. So what that basically means is, yes, I've done the training for it, but then I'm required to do additional training on a yearly basis or continuing education, and I get the most up-to-date research.
Okay.
And I'm pursuing certification as well, which should be estimated to be completed in 2019. I'll get a few extra letters after my name, which is always nice.
Yeah.
But it's taken me 5 years to get to this point to even be prepared to do that certification.
Wow.
It includes 200 hours of training, testing. I'm doing research in my office right now to advance the chiropractic profession in treating children and infants. So it's quite an extensive process if you do hold that certification. The next level is called a diplomate, and that's obviously a much longer and even more intensive process.
Yeah, interesting. So, well, since we're talking about it, what is the Webster technique? Is it one? Is it one procedure? Is it a way of treating?
Sure. So the Webster technique is a specific method of analysis and treatment of pregnant women.
Okay. So it's for women, not for the children.
Correct.
Okay.
Just in expectant moms.
Okay. So we're talking now. We're going to talk in the prenatal. So this is before a mom has the baby while she's pregnant.
Correct.
This is one of the specialties. So let's talk about the Webster technique. That's right.
Yeah. So like I said, a specific method of analysis for pregnant patients only. And it's all geared around the sacrum, which is this orange bone right here that you can see. And we first analyze the sacrum and see if there's any misalignment to the joint in that area. And then with pregnancy and with the Webster technique, we not only approach the body from the back, which is our typical analysis, but we're going to work on ligaments.
I think you may have to lift it up a little bit there to show people. Perfect.
We work on ligaments in this area here, and then we actually turn the patient around, and we work on muscles that overlie this area. We work on ligaments in the front, and then we'll even check their pubic bone here. So it is a 5-part analysis and treatment if needed, that again all focuses on how muscles and ligaments relate to this sacrum or this orange bone that you see right here.
And is this used for symptoms of pregnant women? Is it used just for having more comfort during your pregnancy?
Yeah, so definitely if you're having any sort of back pain, that's
everyone, I think, right?
Yeah, right. It's very,
woman.
very common. The statistic is 80% of expectant moms will suffer from back pain. So if you're having any sort of pain, I always say that's a sign that there's something going on. Your body just doesn't have pain for just because it wants to make you feel uncomfortable, right? It's doing it because there's something going on. So that's a reason why someone might come into my office because they're having back pain or they're having sciatica, for example. But I do believe that all pregnant patients should be seeing a chiropractor. I mean, your body's undergoing some pretty drastic and intense physical transformation while you're pregnant.
Yeah.
You're gaining weight. You're having changes to your center of gravity as your belly is growing and getting bigger. Your posture is changing from compensation from this weight gain. And also you're releasing hormones that are causing widespread instability that allow your body to just shift and misalign where it wouldn't normally do that when you're not expecting. So for these reasons, it can make a pregnant mom more prone to pelvic, which is this area, pelvic misalignment imbalance, and can actually negatively affect birth outcomes.
Okay. Wow. Wow.
What's really great is there's some research that we've done through the organization that I'm pursuing my certification from that shows that this Webster technique can not only help reduce back pain, but it actually can make labor times lessen and reduce the need for pain medication. Because I mean, imagine, I'll give you a nice visual here. Who doesn't like to see that? Baby's about to come out of this hole right here.
Yeah.
And imagine if it's doing something like this,
if
right?
It's twisted.
Or something like this. That's going to narrow the space through which the baby can pass through this canal. So again, my job is really, yes, I want to help someone feel better, but ultimately my goal is just to normalize this pelvic alignment to hopefully allow that birth process to be a little bit easier.
Interesting. Yeah. And then this type of a treatment for an expecting mother, is it something that, do they need a referral for it? Can they just kind of give anyone a call? Things like that.
There's no specific answer to that. Most insurances, in my experience, you can self-refer. You don't have to go to your OBGYN or your midwife or your primary care doctor. But there are certain insurances that do require that. So we always recommend you can definitely, call your chiropractic office and find out if your benefits cover that or if you need a referral.
Okay.
But definitely just check in, with your insurance company independently and see if that's what you need.
Yeah. And then is it very similar to for example, I remember we started going to the doctor once in a while, and then as it got closer to the day, you go a little bit more frequently. Is that how it is with you as well?
Yeah, so if someone's coming to my office and they don't have pain, they're just there because they want to help optimize their birth outcome, make this process a little easier and more effective, which I do see a lot, you'd be surprised. Usually in the first trimester, I'm seeing moms monthly. In the second trimester, we're usually seeing them bi-weekly or twice a month. And then during the third, it's generally weekly. That's the best recommendations.
Okay.
Of course, if they're having pain or discomfort, though that treatment frequency or treatment recommendation would be altered. It would probably be slightly higher if they're having severe amount of discomfort.
Okay. And really the key question for those that are expecting mothers, is this something that is safe? Is it going to make maybe come quicker? Is there anything like that they should be concerned with?
That's a great question. You know, I say this to a lot of my patients, you are more likely to get struck by lightning and in a plane crash on the same day than you are to suffer a severe adverse event from anything a chiropractor is going to do to you.
Okay.
So long story short, the odds are definitely in your favor. I believe it's like 1 in 4 to 10 million, depending on which research studies you look at. But with that being said, you know, it is a medical treatment, and I want to ensure safety, and that's my primary goal. When someone comes into the office, I'm performing a physical exam with them. I want to make sure we're not going to do anything that's going to make their problem worse. But there's no known contraindications in a normal low-risk pregnancy to receiving chiropractic care at any phase or any trimester of your pregnancy.
Okay, good. And are there any other concerns that expecting mothers should have about chiropractic care?
Yeah, I think the number one thing I see in my office is, you know, they have this large belly, like how am I going to lay on the table?
Yeah, how are you going to lay on the table? With that big belly, do you have to have a hole cut out in the table? Or?
No, thankfully no. Well, there's two options. One, we have a special table in our office that has an abdominal piece that breaks away and tilts down. And most moms, even myself, could lay face down on the table through my entire pregnancy. For other moms, we have this option here. So we have some pillows that we can lay on a flat table. And while you can't see too well, what you'll notice is they have like an eggshell in here that breaks down. So you're able to lay face down and give you the opportunity for us to do our work. So have no fear, you will be able to lay on our table while you're pregnant.
Wonderful, wonderful. I think that covers the kind of the prenatal aspects of the pregnancy. Something that I sometimes hear of some chiropractors is in terms of nutrition. Do you help optimize nutrition, or the nutritional component? Do you guys deal with that or not? Or
I think some chiropractors do. We do offer, a few things in our office that I think are really geared towards complementing and reinforcing our chiropractic adjustments. But my personal strategy in the office is I'm a chiropractor. I work with kids and pregnant women, and that's what I focus on. And let the primary care doctors or nutritionists or people that really specialize in that be able to help you.
All the time.
But I give general recommendations, if needed, again, that are geared towards complementing and reinforcing what we're doing in the office.
Okay. So let's say once the baby is born, and then now it's postpartum. I know, is that for the baby, or is it for the mother? Does the mother still need care afterwards, or does the baby need care, or both?
That's a great question too. Yes and yes. So I think it can sometimes be just for the mom, but as I said, I do see lots of infants and children in my office, and sometimes it's both. Specifically with postpartum moms, I believe this is the most underserved population, in society right now. Your body's going through just as many physical changes to become unpregnant as it was to become pregnant. And then you add that physical stress of nursing, carrying a newborn, carrying a car seat, and then add the emotional stress of that too. It's sometimes not an easy time for a lot of parents. And I believe all postpartum moms need some physical support during this time, whether it be in the form of chiropractic care, be in the form of massage, be in the form of physical therapy. Generally, women in my office, if we do take them on postpartum and they're feeling great, usually it's about a 5-visit plan that I call the 4th trimester. So 5 visits that extend over a 12-week period of time. So rather than amping up as it was during pregnancy, the frequency of visits actually amps down as they get farther away.
And is the focus still on alignment like before, or are there other focuses?
Great question. Mostly alignment. That's what I do as a chiropractor. I'm worried about the pelvic balance and the pelvic alignment, but literally their pelvis is opening up to deliver that baby, and there's no guarantee that it's going to come back down into the perfectly neutral position.
Yeah.
So there'll be some things that we'll check that we didn't check during pregnancy, just to ensure that their pelvis is nice and aligned and balanced to prevent future pain or injury.
Is there any place for, like, I know there's a term that we hear a little bit more now, it's called the pelvic floor. And is any of this work, can it be that involved to help with the pelvic floor, or is that a different specialty?
Different in my office. I don't do a ton of pelvic floor exercises or pelvic floor work.
Yeah.
A lot of physical therapists are doing that, and that's what I mean in terms of that postpartum
So you might refer
care.
or say, have them if they need that.
Exactly, refer them there, but they'll still be seeing me at the same time, right? Because the pelvic floor is more muscles, so a PT or massage therapist can work with the muscular component of what's going on, and then I can work with the skeletal or structural component. That way they can get more out of their efforts.
Perfect. And so that's for the mom. What about the baby? In terms of, I guess the mom would just bring the baby in. Do you usually just do a quick little adjustment on the baby when they're there as well?
Sometimes it's for general wellness, you're right. If I've done a good job educating them, and hopefully, for the people watching this today, we're realizing that our back's about a whole lot more than our back, right? And they don't have to have any outward sign or symptom in order to maybe, have something going on with their spine. Again, just like you can have a cavity without having tooth pain. So a lot of parents will bring their children to me just to have them checked after the birth process. It can be traumatic for them even in the most normal natural birth.
Yeah.
If it was a C-section delivery, which is more than 30% of births nowadays in the United States, there can be excessive twisting and pulling on the neck that would indicate that they might need some chiropractic care after birth.
Yeah.
Some moms will bring their children to me for a complaint, however. A big portion of my practice is breastfeeding challenges.
And colic and things like that.
Correct. Lactation consultants and even dentists are referring to me. There's a condition called lip and tongue tie, which is where there's extra tissue underneath the tongue and where the lip attaches.
They have a hard time latching on.
Correct. So they'll get that released, is the word, either by laser or through cutting, and then you can think of us as like the physical therapy afterward. We help them learn to use their joints and their body in a new way. And usually that's about 6 to 8 visits that they're coming into the office. But you said colic too, that's a big thing we can help with. Again, ear infections or even cranial asymmetries. So babies that have flat head syndrome will come into my office and we'll do gentle work to their head to help correct that. Or torticollis, which is actually where there's severe tilting or turning of the head, and they favor one side. So we'll see that a lot in the office too.
Is scoliosis, is that something that can be detected and treated, or is that something?
In infants?
Yeah.
No, generally you won't see scoliosis until
They're a little bit older.
Yes, a little bit older.
Okay.
And we can detect it through the skin at an earlier point than you can with other, like if they do scoliosis screenings in school. There are certain postural changes we can see that can indicate there might be an underlying scoliosis. But by the time we're seeing some of these postural changes externally, we know that the scoliosis is already at about 10 degrees or so, plus or minus 5.
Okay. Interesting. So that's before, and that's after, and then it'll just the maintenance care afterwards, as they get to be kids and healthy kids, hopefully.
That's our hope, right? I think it's far easier to be proactive than it is to be reactive. A portion of the population that I'd love to see more of, and I think needed a lot, are age like 5 to 10. They're starting school. They're carrying backpacks. They're probably in sports and basketball and soccer, and they're carrying heavy backpacks, if I didn't say that already, and they need some help and they need some care while they're growing. I hope to continue to serve that portion of the population more as my practice continues to develop.
Perfect. I know you brought a couple of things to show them on these slides. Did you want to just point out a couple of things in these pictures?
Yes, I would love to do that. So the first picture that we have up there is all about the autonomic nervous system. So that goes back to the first part is when we talk about general chiropractic care. Talking about how our spine's about so much more than our back. So our spine houses our spinal cord and transmits nerves here, which you can see on the slide. And you can see how those nerves connect to all of our vital organs. And so that's why when babies come in with colic or when a child comes in with bedwetting or ear infections, how treating the back can actually affect those underlying organs, for example.
Perfect. Any others that you want to talk about? You had some pictures of some babies there.
Sure. So there's one other slide that you can look at that shows the study and it's mostly wording about how the Webster technique can help improve birth outcomes.
Perfect.
So in both first and second time moms, it'll decrease labor times by 4 hours and help decrease the need for pain medication. So you can see that slide there.
Now, as we conclude here, we'll talk about the Webster technique, because you're the only one in Worcester that does that technique.
Certified, yeah.
How did you get in? How did you hear about the technique, or did you already know about it from school? Do they teach you about it in school?
So in chiropractic college, everyone is trained in treating pregnancy and pediatric. But of your 4 years of chiropractic college, you get 10 or 12 weeks of it. And so to be honest, when I graduated from school, I felt very unprepared to deal with this large portion of the population, because they are such a special portion of the population, require different techniques and different pressures. And so I started taking classes and doing continuing education, mostly out of an area of lack of knowledge.
So you wanted to improve the knowledge gap that, I think whenever we finish school, that's when we start learning.
That's right.
And we realize the gaps. I think when we start, we think we know a lot, but then as you start to practice, you realize how much you don't know.
It's so true, and people are not multiple choice tests, that's for sure. So things will walk through your door that you'd never heard of before, and I started taking those classes just so I could be more prepared and more trained. And then I became a mother myself, and I naturally started to attract that clientele, and I was that clientele of an expectant mom and then a mom with a baby. And so that continued to develop my passion for learning about it, but also that portion of my population in my practice that I'm serving. And now it's just a mastery thing. The more you do it, you realize that it does require a lot of skill and a lot of time. And that's where I am today.
Perfect. Well, anything else you want to share with the audience as we're concluding about you or about chiropractic care? Yeah.
So, I guess the number one thing, the couple things that we didn't talk about is there's other concerns besides just how do I lay on the table when I'm pregnant. I think another thing I get asked a lot is, will it hurt?
Okay.
Because if you've never done it before, you think maybe there'll be cracking and popping, and is there going to be pain associated with that? And to be honest, I've been adjusted since I was 10, and if you go into a chiropractic office and you see people in the waiting room or you see them leaving or entering, none of them are scared or sad to be there. Most people enjoy their treatment in the office, and it's not a painful or scary experience for them. Sometimes if there's an area that hurts and we have to do treatment, it can be a little bit painful at that time, but I think it's important to know that for the most part you leave feeling better and you're happy to be there and it's not going to hurt you. If you are scared of the cracking and popping, chiropractic literally means done by hand. That's why I keep putting up my hands. Our hands are our main method for diagnosing you and treating you. That's called a manual adjustment, where you get that cracking or cavitation. We do have other options in the office, one being this tool right here. This is obviously a smaller version. You would imagine a patient laying on the table face down, so it'd be as big as their hips are. So what it can help us do is we can actually activate a lever, and then we can use gravity by pushing on the table to help magnify the force of our adjustment. So you don't have to get in any weird positions. The table just drops down ever so slightly, but it's still just as effective and achieves the same result as our hand. Additionally, we have a tool-assisted adjusting that a lot of patients like. It looks scary. It kind of looks like a syringe.
It's like a needle,
but I'll let you feel it. It's not scary at all. It delivers a very small surface area and a small amount of force, and we can vary that force by having a 1, a 2, a 3, or a 4. Say if we were working with a larger patient in their low back, it would be much harder. Now this is a little bit harder to understand how it works, so I brought a little tool with me here. This is just a marble example, and I always show how I can't make this marble move with my hand no matter how hard I hit it. But if we were to use this tool here, and this was the surface of a patient's skin, and we can use it, you can see
look at that,
how it makes that marble bounce. So it's going to be able to get through the skin, the underlying tissue and fat, and affect that underlying joint. Now, the purpose of treatment in the office when we do a treatment on someone is obviously we want to help them feel better if they do have a pain or a problem. That's why you came in our office, and we want to help you feel better. But my hands aren't doing the healing, right? Their body's doing it.
Correct.
And when we do the treatments with our hands or with one of these tools here, it helps you break up scar tissue, increase range of motion, bring blood flow to the area, and most importantly, stimulate the underlying nerves that are going to every part of our body. Philosophically, I tell a lot of my patients that the adjustment isn't healing you, that, you know, really it's just bringing your body into a present state of consciousness,
So
or a present state of
heal
awareness.
itself.
And it can heal better from that point forward, right?
Yeah.
That's a little bit of a different way to think about it.
Perfect.
Yeah.
Well, thank you so much, Dr. Falcone. Appreciate it.
Of course. No, thanks for having me.
Hey guys, thank you for watching Healthy Living. You're going to find a few links here I'd like you to click. One is to subscribe to this channel on YouTube. Also, you can learn more. There are some videos here you can see, and then also there's a little survey.